Welcome to Straight Talk with myOBMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write on all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. Hello, and welcome to Straight Talk with myOBMD. I'm your host, Dr. Dana Smith. Today, we're going to be discussing the prospect of surgery. Is this surgery right for me? If you have been offered surgery, this is the podcast for you. There are 7 things you need to ask yourself before signing the dotted line on any surgical procedure. Stay tuned so we can have a full discussion on how to proceed with the option of deciding on whether this surgery is right for you. Now, we know that deciding whether or not to have surgery is a very consequential decision. Regardless of whether it is major or minor surgery, it's still a very important decision. As with any significant life decisions, you want to make sure you're asking yourself and your medical team all the right questions. Having full knowledge of the expected results, the risks, and the alternatives will allow you to make the decision that best suits you. Here are 7 questions to ask when deciding on whether this surgery is right for you. The first question number 1. Is this problem immediately life-threatening? So, for most problems that are immediately life-threatening, most people are facing the prospect of surgery in an emergency room. So, for instance, if you have a symptom, you go to the emergency room and they say, hey, you have this issue. The treatment that we're offering you is surgery. Then that is an option that you want to give full consideration to. Now, you still want to ask yourself, what are my treatment options? What are the alternatives? What happens if I choose not to have surgery? But in most cases, when you're being offered surgery in the emergency room, then it's something that most doctors will not offer patients surgery in the emergency room setting unless they feel it is something that not having surgery will be an immediate threat to your life. And if that is the case, it will be prudent to take full advantage of that surgical option because, of course, we want to survive. And so if you have a problem that is immediately life-threatening, that can only be solved through surgery, or that is the best way, the best chance of success of handling that problem, then that is an issue that you do want to take advantage of the surgical option that is being offered to you. Now, let's say you're not in an emergency room, you're in a doctor's office, and you are being offered the option of surgery to treat a medical condition. So that's fortunate that it's not immediately life-threatening and you're able to be in an environment where you can discuss and ponder this decision under less stressful condition. So the second question you want to ask yourself is, does this problem pose a threat to my life expectancy? So what that means is if I choose not to have this surgery, am I chipping away at my longevity of life? Will this problem basically bite you in the rear end later in life? So there are problems where it may not be a major problem to start off with, but by not taking action, it morphs into a more serious problem. More serious problems will always require more aggressive treatment. More aggressive treatment will always carry more risk. And so, if surgery is the only approach that will work for this particular problem, and by not having surgery, it may not threaten your life immediately, but it may threaten your life's expectancy, then that is something that you want to consider. And I'll give you an example. So, for instance, abnormal vaginal bleeding. So, there are different causes for that, and there are different treatment options, some of which involve medicines and some of which involve surgical and non-surgical procedures. Let's say you've tried all the non-surgical procedures and medicines for whatever the condition is that is causing your abnormal uterine bleeding, and they haven't worked. Your body is not responding. And your surgeon says, I think you need to have surgery because we've tried everything else and it's not working. Now, if you say, no, that's fine, I'm just going to continue to live with this issue, keep in mind, what are the consequences of living with this issue? For instance, for anemia, if your anemia progresses to the point where it becomes severe, anemia does carry the risk of having a heart attack and stroke, fainting, or collapsing. And those secondary conditions can and will likely affect your life expectancy. And so this is what I'm trying to say, in the sense that if you have a minor problem that can be treated with surgery, by not taking action, if that inaction will subsequently threaten your life's expectancy, then surgery should be given some consideration. Now, the third question to ask yourself: is there a threat to my livelihood or my life's quality? So, is your quality of life threatened, or your livelihood, right? Where our livelihood is our jobs, our income potential. So, if your income potential is threatened, that will automatically cause a threat to your quality of life, because we all have a certain degree of income that we rely on in order to live comfortably. And so if you no longer have that, then your life's quality will definitely be threatened. But here is how you decide that. If you have this condition, and this condition is starting to interfere with your decision making on social gatherings, on travel, you worry that, hey, will my symptoms occur while I'm out? Are your symptoms causing you to miss time from work? Or by not getting it addressed, will you be able to still continue working in your profession unhindered? So any medical condition that is interfering with your attendance at work, your performance at school, or with your social engagements, that is something that is interfering with your quality of life. A reduction in your quality of life is just as important as a reduction in your years of life. So if your quality of life is being hindered by this medical issue, and surgery is the only treatment option, then that is something that you may want to consider, because maintaining your quality of life is important. Fourth question you want to ask yourself is, what are my surgical alternatives? So, any surgery has a goal, right? So, the goal is not just to remove the organ, the goal is to treat a disease process that is going on. So, whether that is internal bleeding, external bleeding, infection, inflammation, cancer removal, the goal is to treat a condition. And so you want to ask yourself, and you want to ask your team, your medical team, your physician, your surgeon, hey, if I choose not to have this surgery, are there other medical processes that I can take advantage of that will give me the same or similar results? Now, the goal for each individual will vary. So, For instance, again, with an example of abnormal bleeding, some ladies may say, hey, I want this condition to go away completely. I do not want to think about it. I do not want to deal with it. I just want it to go away. Okay. And in that instance, surgery may be your best option because of what your goals are. Your goals are complete and absolute resolution of the problem. And you may or may not be able to get that with medicine, or surgery may be the best way for you to go about achieving that goal. Now, let's say your goal is different. Let's say your goal is, hey, I don't necessarily need to have this issue go away completely, but I would just like it to be mitigated. I just want to just have my symptoms be to the point where they're no longer interfering with my ability to function. I can live with a little bit of bleeding. I can live with a little bit of pain, whatever it is that this condition is producing. You feel like the level of symptoms that you're experiencing, you just want that to be reduced and not necessarily go away completely. So in that case, you may be able to speak with your physician and see if there are other options that can achieve the result that would satisfy you. So, non surgical options may be able to achieve a fraction of the results that you would have gained from surgery. And if your goal is simply to mitigate your symptoms and reduce symptoms rather than having them completely go away, then the non surgical options may be fine for you. If, however, your goal is, I want complete resolution, then for that patient, surgery may be the best option. And again, your surgeon will let you know what to expect at the completion of surgery. What are my surgical alternatives? That is question number 4. Question number 5. What are my surgical risks? So, what are the risks of surgery to me? Okay. So all surgery carries certain degree of risks. All surgeries carries risk of bleeding. All surgeries carries risk of infection, and all surgeries carries risk of damage to the nearby structures. So these are general risks for all patients who are undergoing surgery. Your body and your condition and your baseline medical health may increase some or all of those risks, or it may be decreased for you depending on your baseline health. So your surgeon will outline the risks that are specific to you. Each person have unique qualities that may increase or decrease certain risk of surgery. And so you and your surgeon will decide on the risks that are specific to you, not necessarily the risks that everyone experiences, which will still be there, but then there may be risks that are specific to you based on your own medical issues. And so you want to know, what are my surgical risks? What are the risks specific to me? Okay. And that's something that you and your doctor will be able to discuss. Now, question number 6. When should my surgery be performed? The timing of surgery. The timing of surgery is just as important a question as, should I have surgery? So we discussed at the beginning of this talk that life-threatening emergency surgeries are performed almost immediately. You really don't have time to sit down, reflect, and contemplate all your options because there's very little latitude in timing allowed when a true medical emergency or a true surgical emergency exists. Non-emergency operations, however, will give you the luxury of planning. Okay, so you're able to plan your surgery according to your schedule. Now, your surgeon will counsel you on the recommended timeline, and they'll say, hey, this is something that we should do within the next few months, or as long as you do it within the next year, whatever the case may be. Keep in mind that if you make a decision to proceed with surgery, it is best to have your surgery performed at the earliest time you can. Procrastination is not your friend, okay? The reason being, as you wait, your body changes, your illness changes, and typically your illness may progress to the point where the surgical treatment required is more involved than the surgical treatment that would have been needed when the condition was at a less degree of severity. So you want to make sure that the timing, when you do have the luxury of deciding on when to have your surgery, you don't want to procrastinate. You want to make sure you do it at a time that is right for you, but also do not keep putting it off, because surgeries become more risky if your disease progresses or if your health deteriorates. And so it's always best to go ahead and proceed in a timely fashion if that is the decision that you have made to do, to proceed with surgery. Final question: will my surgery work? Will this surgery achieve the goals that you want? Will it achieve your desired results? Will you get the answers you're looking for or the relief of symptoms that you want? So, surgical results can never be guaranteed. No one can say, hey, with certainty, this is what will happen. However, your surgeon will tell you their degree of confidence. They should be able to say to you, hey, I have confidence that this will be the result that we can expect to see after your surgery. This is what typically happens. I don't see any reason why it shouldn't happen in your case. Or they may say to you, we're giving this a shot, but there's no guarantee. Your case may be unique and have certain challenges where I'm not certain you can expect the results that I see typically. So, will your surgery work? Will you get the results that you're hoping to get from your surgery? And only your surgeon will be able to answer that question. Together, you and your surgeon will determine what is most suitable for you and what's the best way to go about getting the results that you have both agreed is best for you and your health. So, these are the questions to ask when deciding on whether or not to have surgery. Is this problem immediately life-threatening? Does this problem pose a threat to my life expectancy? Is there a threat to my livelihood or my quality of life? Number 4, what are my surgical alternatives? 5, what are my surgical risks? 6, when should my surgery be performed? And 7, will my surgery work? I hope we've been able to bring to light some of the questions that you should consider in deciding on whether or not to have surgery. Please visit our website for more information on this very important topic of deciding on, is this surgery right for me? I'm your host, Dr. Dana Smith. Thank you for listening. Thank you for listening to another episode of Straight Talk with myOBMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with myOBMD.